you. A really cool segment and a great guest here that it's very informative for you, so take a second and listen to this. A new study of Journal of Pediatrics estimates that 1 in 40 children have autism, and they are on the autistic spectrum or Autism Spectrum Disorder, equaling about 1.5 million children in the United States right now. This is an increase from several past reports, but here's the question, are the numbers accurate? Here to shed some light and answer that question for us of Diagnosing Autism, licensed clinical psychologist, Dr. Cindy T. Graham, or Dr. Cindy.
Right.
Thank you so much for being here.
Thank you.
Let's start first off, the new study. Are the numbers accurate, and is it a valid study?
Right, yeah. So overall, I would say that yes, the numbers are pretty accurate, they're pretty valid. Sometimes we can start to maybe say there could be some factors related to the study that might lead to an overdiagnosis. Things having to do with like the fact that caregivers were reporting it, so it's not necessarily a trained professional who is providing that information. There have been situations where I've worked with children where they've gotten the diagnosis from school, but not necessarily from like a licensed professional. So there can be factors there. Also, there's a lot of overlap between symptoms of autism and then other things, especially social anxiety, other forms of anxiety, OCD, and those can also lead to a higher diagnosis. But overall, we're really looking at a time period where there's a lot more awareness for what autism is and the symptoms of it. So we really are finding that more physicians, more families, more teachers are familiar with diagnosing, or at least recognizing the symptoms to kind of suggest that the child get tested.
It seems like, 5-10 years ago something, autism was kind of black and white. You either had it or you didn't. Now there's a whole spectrum.
It is.
Talk about that if you don't mind.
Yeah. And so in this most recent edition of our diagnostic manual that came out, it kind of merged lots of different diagnoses, 5 different diagnoses into one. So everything from like high functioning individuals who have no issues with speech, who interact, but they're just kind of a little bit awkward, or they might not quite get some of the subtleties of social interaction, all the way down to what we typically think of someone with autism, where they might be nonverbal, they're rocking, they don't really maintain eye contact. So there really is a whole wide range of symptoms.
The word epidemic, is that something that we should even, put in this case right now?
Right, no, I don't think so. And it's something that we see in psychology from time to time. So back in like the 90s, ADHD was very popular, and that was what we were seeing an increase in. Also, when I was in grad school, childhood bipolar disorder was becoming very popular. So it just has to do with, what catches wind. Even though autism has been around for really officially diagnosed back in the 1940s.
Oh, wow.
Yeah. So for a while, it's that we're really, like the science is really catching up to being able to diagnose the disorder and then getting the services necessary to help the individual. So that's also another major motivation for getting diagnosed early, is because early intervention really helps someone to have better outcomes and to be less affected by their symptoms as they get older.
If there's a parent at home right now that's a little concerned, what do you tell that person? Because there has to be a factor of denial and fear in a parent and stuff like that. What do you tell a parent that is a little concerned?
Right, and that's a tough one. So one of the things that I try to encourage parents is that the outcomes for their child, like their child will certainly has the potential to become independent, just as independent as any other child, that they will have friends, that these are, and especially it highlights the need for that early intervention and getting help as soon as possible. And even if they're a little bit late to the game, that it's still really never too late to get services. There are lots of social skills groups. At my practice, we even have a social skills group, and lots in the area that can teach kids how to interact, and so that it's not quite so robotic and scripted, but that it's actually natural.
Some signs that they can look for, that maybe some red flags, if you will, for lack of a better phrase.
Right, so we actually start very early on, even as early as 6 months old.
Wow.
One of the questionnaires that you're asked when you go to the pediatrician with your child actually have to do with autism spectrum disorder. So we want to see that kids are looking at their parents, that they're looking at common objects. So if there's a ball that's across the room, that the child will point to it and say ball. By about 3 years old, that they're playing side by side with other kids.
Interesting.
By 4 years old, that they're playing together with kids. And then there are also the particular interests that people usually notice most of all. We were kind of talking in between break about usually there's an obsession with fans, or sometimes light switches, trains.
Trains.
Yes, those are also things that people will become, that are symptoms of autism.
Great information. Some common misconceptions, doctor. What are they?
Yes. So first of all would be that autism is caused by vaccines.
Okay.
The
It's
original,
huge.
it's very huge. It gained steam from a study that came out in the late 90s.
Cut and dry, though, they are not from vaccines.
They are not caused
Okay.
from vaccines at all. The ingredients that they believed caused autism have been removed from the vaccines, and we're still seeing an increase in autism. So it really cannot be attributed to vaccines.
Interesting.
Yeah.
Is there a cause? We were talking about this a little bit, and I was worried it was a dumb question, but it's
No,
not.
it's
Is
not.
there a cause for autism?
There's no one cause that we've identified so far. Even in twins, in identical twins that share the same, egg and sperm, there's
Fascinating.
still, at best a 50 to 60% concordance rate where both of them are diagnosed. So there's really, there's a whole host of environmental factors that can be causes as well. Some genes are implicated, but there's no one factor that's causing autism that we can tell.
Lastly, I want to touch on this, if you don't mind. The difference between being autistic, and having autism. They don't like the phrase being autistic, correct?
Right.
That's not the right way to say it.
Yeah.
You have autism,
Right,
correct?
exactly. It's an individual, usually an individual or person diagnosed with autism spectrum disorder, because when you put the diagnosis in front of the name, you're kind of putting the emphasis on the actual label. So an autistic person, you're kind of defining the person based on the diagnosis rather than as an individual first. And so that's why we like to say person or individual diagnosed with this disorder.
Yeah, you don't want to put a label on it.
Right.
Exactly. Like I said, I grew up with one child with autism, and he was one of the most fascinating people and kids I've ever been around. So, Doctor, thank you so much for being here,
thank
Dr.
you for
Cindy.
having
If
me.
someone wants more information, real quick, where can they go?
Yes, so Brighter Hope Wellness Center, or brighterhopewellness.com is my website. I practice at Brighter Hope Wellness Center. You can also find me on Instagram, Twitter at Cindy T. Graham, Ph.D. And yeah.
Thank you so much. Appreciate it. Dr.
you.
Cindy T. Graham, licensed clinical psychologist. Thanks for being here. Plenty more, of course, still here on Good Morning Washington. Fun social activities to beat the winter blues. Kid going around town to the D.C. fray.